WMEL.
That's the sound of the 1951 Ford Victoria Hot Rod, fully restored and donated from the private collection of A.J. Hires. It's the 2017 Win the Classic Ford Car Raffle to support Helping Seniors of Brevard. You have to see this car. I'm Kerry Fink, and I'm inviting you to visit helpingseniors.brevard.org for full information on this exciting car raffle. That's helpingseniors.brevard.org. Stay tuned for more info on the Talk to Me radio network. We're glad that WMEL cares about the space and Treasure Coast.
The views expressed on the following program are those of the hosts, callers, and guests, and are not necessarily those of WMEL staff, management, or advertisers.
This is Joe Steckler, your host for Helping Seniors. I got a little busy there, and I was getting a signal to go on.
Yeah,
I didn't do it.
Certain conversations you need to have off the air. Certain conversations you need to have on the air.
Yeah.
You know, and if you didn't come on, I think Gary was going to come on. He was going to introduce us just before he falls asleep, so I'm not sure if that's going to happen.
Well, no, I would have introduced you and everything, but Joe's normally right there. The Admiral's always there paying attention, but I guess, I guess he figured,
Well, there's a certain amount of excitement that I generate here, so we can understand why Joe...
Well, I just am not used to starting on time, so it's I'm only kidding. But
God.
I was asleep at the switch, folks. But this is Joe Steckler. We're live. Lee Sheldon's in the booth with me today, and but this is the Thursday edition of Helping Seniors, and our show is really designed to inform, educate, and help people. And, there's been a lot of controversy going on here in the last 4 or 5 months about nonprofits and the commissioners making a really, really unwise decision to eliminate nonprofit funding from the budget. And I've decided to do what I can to use the honest truth to help you, our listeners, and the viewers of the television shows and the readers of our media stuff to have some first-hand facts about what really is happening and what's not happening. We're the only nonprofit that has made a decision to sort of take on everybody and say, hey, this is not right. You think about yourself. If you're in your 70s or 80s and you've been a taxpayer for years and you get to this point in your life, you've saved up a little bit, you're living fairly comfortably, and we've got over almost 24% of our county is a senior citizen, while less than 18% are children. And you've got Children's Services Council, and you've got all these things. Now, listen, don't mistake me. I'm not saying do away with Children's Services. I've never said that. I will not say that. But I think you have to be fair, Lee. You have to understand that seniors have needs the same as children have needs. And when you start out, you have parents that help you. As you get older, hopefully your children will help the parents if they had children, but there are a lot of children that will not help their parents. And parents have given almost everything they've had to raising children, yet they get to a point in their life where they do need a little help. And I'm not saying that we owe seniors a living. I've never said that either, but I think that we need to be fair and how we provide services. You're a periodontist,
yep,
and you treat people. You look at their mouth, and you can tell. I say most of the time you can probably tell from looking at a person's mouth what kind of general health care they've had their entire life.
Yeah, or how well they've taken care of themselves their entire life. That's what I can tell.
Yeah, well, that's right. Yeah. But what the appearance of the mouth is dictates what a lot of the general care of the rest of the body has gotten.
Oh, yeah, sure.
So I think it's important that, when I have Dr. Sheldon on the show, Dr. Sheldon, I went back and I've looked at a lot of the shows we've done over the last 10 years.
How many shows have we done, Joe? Do you know?
Oh, golly, Lee, I
know we've done at least 13 or 14 TV shows, and so radio shows is a lot more than that.
Actually, we've done over 20 TV shows.
Oh, really?
And on the radio shows, I would say 12, close to 75 or 80 radio shows. So, that's a lot of information, but we've talked about nutrition. We've talked about the effects of salt, sugar, good nutrition, poor nutrition.
Talked about the fact that I break teeth at the chiropractor's office. We talked about the fact that sometimes things go well for you and you admire periodontists, and other times you just cringe in pain, even though I never put you in pain. We've learned things like that as well. We've kind of gotten more involved in personality discussions sometimes rather than physical discussions. Would you agree?
I agree, but life itself is a study of personality.
Oh, it absolutely is.
And, if you forget that each individual has his or her own personality, you forget a lot of what each of us brings to the table. It's life is balanced and unbalanced at the same time, and if everything worked the same way all the time for everybody, it would be a very mundane world. And we need variety. We need to have people that stir the things up a little bit. We need to have people. We even need a guy like our president right now that stirs things up a little bit.
Yeah, he's doing that.
He's doing that. But seriously, what we've tried to do with helping seniors over the years is develop a system where the people that listen to our radio show or watch our television show or read our columns in a newspaper can believe that they're getting access to accurate information. I don't know of a column that I've ever submitted to Florida Today or to any of the magazines we're currently writing for that everything's, to my knowledge, everything is as true as we can make it.
Yeah.
And so I think that makes a lot of difference when you have the degree of versatility that we have here in Brevard County, because there are so many different kinds of people here, so many different lifestyles. Old Florida, new Florida. There are people that don't take care of themselves. There are people that do take care of themselves. And there are people that expect. And there are other people that just go right along with the flow. They live their life. They don't cause anybody trouble. They take care of their own needs, and everything else. But there will always be somebody that needs information. And that's exactly what we've tried to provide through this radio show for 16 years.
Yeah, I try to provide it in a more humorous way sometimes, and sometimes I just give you a hard time.
I know.
Every once in a while, you'll give me a hard time as well.
But sometimes it's deserved.
Yeah, I guess so. So, I mean, you talk about veracity. I got to tell you, I mean, I've been involved in some things lately. Like I bought an advertising campaign from somebody and did it, and all promises were given, and none of the promises were kept. So understand, even somebody who thinks he knows what he's talking about every once in a while will be taken advantage of. And I'll tell you, one of the biggest problems here, Joe, and it has nothing to do with our topic, is that when that occurred, I actually felt beaten up, and it was like, all right, let me just take a break from this, and let me retreat back into my own comfortable environment. For me, that was the worst thing I could do. It was like, all right, because I run an organization for periodontists, and that was where I was taken advantage of, or at least things didn't go the way they were supposed to be. And so you crawl back into your shell, and crawling back into your shell, then you start to concentrate on yourself and your body and all sorts of things that happen as we get older anyway. And as soon as I got my batteries recharged, which occurred today when a couple of events happened, I said, okay, good. Now I know what to do and I can fight forward. And now my back doesn't bother me so much. And now I'm thinking forward rather than thinking backwards. I'm thinking, what else can we do? How else can we do it? It makes a big difference. I think one of the biggest concerns that I have, because I'm kind of in the semi-retired mode, I'm not doing surgery anymore. I've got Michelle there; he's doing the surgery, and Matthew's doing the dental work, and they do a great job. But and I do work a lot because I run that run that organization. But I think the worst thing that can happen is that you get in vacation mode and you just stay there. At least the worst thing for me. And then you're concentrating on things.
When you no longer have a challenge.
Yeah, that's right.
Yeah.
So, I mean, you're doing a lot here, at your age, but even more at my age. You run circles around me, and you're a little bit older than I am, and you have your aches and pains too. But there's a certain amount of, all right, if I get out there, if I help, if I volunteer, if I create something new, all of a sudden, there's a certain vitality that I have that you can't substitute anything for it. You can't substitute a pill. You can't substitute therapy. You can't substitute any of those things when you are creating something new. I can't imagine what you would be like if you were sitting around doing nothing.
I can answer that question.
Tell me.
Terry found some, we call it vibrators, back vibrators, and some of these things have 8 or 10 motors, 12 motors in them, and they'll fit in your chair. And I have a recliner chair, and I had a vibrator back, and it was a lazy boy chair, and the thing broke, and we just really couldn't get it repaired. So Terry found these other back vibrators, and when I really hurt bad, or if I'm really tired, I sit down in the chair, and the back vibrator, just those rotors make my muscles work. And if I really feel bad, I can sit down and not almost, but I do go to sleep with those rotors. But you lull yourself into a sense that, gee, why do anything? Just sit here and let these rotors work, and I don't even want to do anything. Well, that's bad.
Yeah, it is bad.
That's not good. And one of the things I fear, you and I both have written articles in a newspaper about exercise and the importance of bone density, muscle mass, and you're a doctor, you understand that. You're a dentist, but you understand it from being your medical training. One of the worst things we can do as we get older is just let ourselves go.
Yeah.
And this is something. This is not what we were going to talk about today, but we are going to talk about this. It has to do with pain, but we want to talk about that. But let's just talk about this for a minute, because I think this is a topic that. One of the reasons that I like to write for the newspaper, because try to imagine. Right now, we have a group of county commissioners and people in the county agitating to get the roads repaired. I understand that, and I drive too, and I don't like the potholes either, and I think we make a lot of mistakes. But we do some dumb things about how we fix the roads in the first place, about putting grass on the medians instead of bricks, where we have to maintain them, but also something we don't have to maintain. But having said that, there are a lot of things that we could do that we don't do, and when we lull ourselves into a sense that we don't have to be challenged as we get older, I think that's a bad thing to do, because if I feel bad, if I can get aggravated at myself when I hurt so bad, and I say, gee, I really don't want to walk because it hurts to walk. But I know if I do force myself to walk, I'm not going to feel tremendously better, but I know it's going to get my blood and muscles moving and nerves sort of untangled in my legs, and I know that's good for me to do.
Yeah.
And if you and me talking on the show about these topics, if we write about in the newspaper, people reading or listening to us can say, gee, if Joe and Lee can do those kind of things, why can't I do those kind of things?
Yeah, and that is part of the deal, because as Helping Seniors to Provide, we are there as a service organization in order to be able to provide information, and that's good. And it's also to provide verifiable information. In other words, everybody who is a member or who is a sponsor, of Helping Seniors to Provide has been vetted in some way, so that if you're dealing with an HSOBC sponsor, you're going to get a fair shake. That being said, sometimes we have to give ourselves our own fair shakes. Sometimes we got to get, and that's what I felt. I felt that this week. It was interesting because Eleanor and I took a vacation with the kids, with the entire family. We went to Europe, and Eleanor and I went to Europe first, and we did a little river cruise, and then we did a Disney cruise with the entire family. It was fantastic. 12 days, and it was a British Isles cruise, and it was fantastic. But I was on vacation, and I stayed on vacation once I got back, and that was the problem I was having. And so, if we're looking at it from a personality standpoint or from a personal standpoint, let me just do that. Okay, good. If we look at it from a personal standpoint, if I'm on vacation when I get back, well, there's only so long you can be in vacation mode before you become in lethargy mode, in good, let somebody cook for you, let somebody clean for you, let somebody do everything for you. And frankly, that's a bad way because you go downhill. You know, I didn't have Mickey Mouse around anymore to be able to help me. I had to do it myself.
Well, and I know that you believed in vitamins and different things and health foods and all that.
Oh, Dr. Lee, I'll be happy to come on over to the office anytime you want. It's okay by me. Oh, boy.
Quiet, Gary. But
that was good, Gary. I like that.
We've
hey, Gary, you're not asleep yet. What's the matter?
We discovered something that has been advertised. It's a it's a juice type product, and Terry's been giving me some of that every day, and I want to think it's helping me, but I'm not really sure. I notice that at times I don't need my pain medication as much as I generally would. But once I say that and think I can get off of some of this stuff, it just knocks me back and I get laid back low again. So I guess what I'm trying to say is, as we get older, we have so many things that affect us adversely. We don't know what the cause-effect relationship is sometimes, and the best we can do is just try to work our way through it.
Yeah, I mean, you talk about the juice product. Essentially, you're saying we need to eat our fruits and vegetables, which is what we always knew, and so there's a way of taking fruits and vegetables without eating the fruits and vegetables. It's still good to eat fruits and vegetables, and we probably don't concentrate on that nearly as much. If you look at the American Heart Association, look at the American Cancer Society website, you know, we grew up saying, all right, you need a combination of 5 fruits and vegetables a day. That's undershooting the mark by 1/3. 15 servings of fruits and vegetables is really what we need per day in order to be able to help ward off some of the things we're trying to prevent from occurring, including some evidence now against Alzheimer's disease if we eat fruits and vegetables. And so when we look at heart disease, we look at kidney disease, we look at diabetes, we look at obesity and all the things that are attached to that, the more we concentrate on eating fruits and vegetables, the less those things are going to attack us. It's kind of neat. And so you talk about the fruits and vegetable product, at least I think the one that you're talking about, all right, that's a way in order to be able to get more fruits and vegetables. And frankly, no. I mean, it's not going to cure disease. You're not going to be instantly healed, but you're certainly going to put your body in a better condition to be able to fight off disease. That's why we're concentrating so much on, we're not saying be a vegetarian, but we're certainly say make yourself have a plant-based diet because you will feel better and you will do better. And Gary can have his cheeseburger once a week as long as he's eating fruits and vegetables the rest of the time. That's what we need. So it's something that we can concentrate on, and it's something that we can do fairly easily. We can go to the fresh fruit and vegetable section at your local supermarket and make sure that you're concentrating on that. Certainly concentrating on that a lot more than concentrating on the thing that comes in the can, that comes in the box, that comes in the freezer section. You know, concentrate on some of those other things. And frankly, I'm a pretty good cook. And if you don't know how to cook, you can learn how to cook pretty fast. It's not that big a deal.
We live in the heart of avocado country, and we have had just rotten luck lately with avocados behind the store. They're filled with a black liner through the whole doggone avocado. So one we've been getting.
Okay.
And it just is so discouraging. But listen, you know, when I asked Dr. Sheldon, I said, "What do you want to talk about today, Lee?" And he said, he wrote back and he said, "Let's just talk a little bit about tooth pain because tooth pain is something that everybody can identify with. Generally, I would say that if you live your life without having a tooth pain at some point in your life, you're a lucky person."
Yeah. So, I've never had tooth pain.
Pardon?
I have never had tooth pain.
You never have?
Never.
Are you going to talk about tooth pain still?
Sure. I can identify it for others, but I've never had it myself.
You know, I went through a thing about 6 or 7 weeks ago.
What happened?
Two of my upper teeth were hurting in my gum area, and I wasn't sure if it was the sinuses causing the problem or if I had some other kind of an infection. All I know that my sinuses drained a lot, and it was causing a lot of nausea, and my stomach wasn't right, but it hurt. and it lasted for a couple of weeks. And I just began to wonder what is really wrong. And then I thought, well, we went into urgent care, and they diagnosed us with a borderline strep infection.
Mm-hmm.
So one was above, one was a little bit low. So they just put us both on amoxicillin and said, take this and let's just see if we can get it cleared up. And we did.
Yeah.
But sometimes we can, I think, perhaps you, as a dentist, you can tell our listeners some of the perils of Pauline about ignoring tooth pain and trying to find out if it's related to the tooth or the sinus.
Well, it's interesting because if you take a look at the back teeth on the upper arch, most of us have the sinus interweaved among the roots of the teeth. And so it can be very confusing to you, to the patient, and sometimes confusing to us as to whether that upper tooth pain is coming from the tooth or whether it's coming from the sinus itself. And it's been a big point of differentiation. I'll tell you a story. I had a patient who came in, and it was recommended to that patient that he have 2 root canals in the area that I'm talking about. And I tested those teeth, and both of those teeth were alive. It wasn't those teeth that need root canals at all. The patient needed some sinus medication in order to be able to take care of the problem. So it becomes a real big concern when we start to identify tooth pain and we're saying, all right, it's got to be coming from the teeth. Often it is. Matter of fact, we did a whole show, and I wrote a whole column on what occurs when you let a tooth go too long, that in fact a bad tooth, can create a hole in the sinus, and then that's horrible because when you extract the tooth, then you're not only extracting the tooth, but now some capable surgeon has to go in and suture up a piece of tissue between your mouth and your sinus, so your sinus doesn't become infected from the tooth. And it's no fun to do that surgery, having done that surgery several times. So
wait a minute. What do you mean? How did the tissue tear in the first place if you had the problem?
Okay. So let's assume that there is, Gary, you want to say goodbye to me for a while? A few minutes? What? 1, 2, maybe 4, 5, 8. Okay, so you have a tooth, and let's assume the tooth becomes infected. Okay, so that means let's assume it becomes infected. It may become infected, and we'll never know what happens. We've got to go to a break.
We'll come back on the other side of the break because this is interesting. What Lee's going to talk about, folks. And I want you to hear what he has to say about this because it's something that's very, very, very realistic. Stay with us.
WMEL. That's the sound of the 1951 Ford Victoria Hot Rod, fully restored and donated from the private collection of A.J. Hires. It's the 2017 Win the Classic Ford car raffle to support Helping Seniors of Brevard. You have to see this car. I'm Kerry Fink, and I'm inviting you to visit helpingseniorsofbrevard.org for full information on this exciting car raffle. That's helpingseniorsofbrevard.org. Stay tuned for more info on the Talk to Me radio network. We're glad that WMEL cares about the space and Treasure Coast.
This is Joe Steckler, folks, back live with the second half of Helping Seniors. Our job is to inform, educate, and connect seniors and those that care for seniors to resources. If you want to talk to Kay, the information specialist, you can reach her at area code 321-473-7770. Just to give you an example of some of the types of organizations that are our sponsors that help us provide a range of care. Of course, there's Dr. Sheldon, the dentist, with his practice. And then we have assisted living facilities like Hibiscus Court and the organization called Seniors Helping Seniors, Vitas Hospice. We have an attorney, Bill Johnson, elder law attorney. We have a roofer. We have a handyman. We have reverse mortgage services. And so what I'm saying is we have a capacity for referring you to real specialists that can help you solve a problem. A lot of seniors. A good example. Let's say somebody's got a $200,000 home and it's all paid for. They're in their 80s, and they're living on Social Security and marry a very small amount, maybe $50,000 or $75,000 a bank. Yet you have $200,000 worth of equity in their house, and they want them to leave a nest egg for their kids. Well, might it not be better to think about taking a small reverse mortgage out on their home, spending $10,000 of the money, still living in their home, fix their roof, keep their home safe for themselves while they're living in it, and still leave something for their children. These are types of things that, if you know where to go to get the right kind of help, you can do it without being fleeced and stripped of your savings and everything else. You just have, as we get older, folks, we just have to be careful about who we're talking to, because I could recite you case after case after case where people that knew better have been scammed, and a lot of the reasons people won't talk about it is because they're ashamed that they have been scammed, and they just don't want to say anything about it. Yet, if they told people that these types of things could happen, if it happened to them, might be a lot easier to happen to other people who are not well informed. So there's a lot of things that we can do to help each other as we do grow older, and that's one of the purposes of our show. And that's why I try to have panelists on the show that can help add a lot of different things. Because Dr. Sheldon was talking about tooth pain before we took the break, and I want Lee to finish telling a story that he started. But tooth pain can be very, very painful, and if you don't know what's causing it, it's even more painful because it's an unknown.
Yeah, it's worse. So let's talk about the story. But before that, but one thing I didn't cover was that person needed 2 root canals, was told he needed 2 root canals,
right,
and didn't need any root canals. If ever you're told you need two root canals side by side, that almost never is necessary. So it means not enough diagnosis is made. I was going to say make sure you go to an endodontist, but unfortunately it was an endodontist who made this bad diagnosis, so make sure you go to a good endodontist who knows what to do in terms of diagnosis, or come see me. But anyway, let's go back to the other story, because you asked, how can you blow a hole in your sinus? Which can, okay. So let's assume you have a tooth that's held in place by a bridge. Okay, a fixed bridge. Something where that tooth is cemented to another tooth in order to replace the tooth in the middle. So get this picture. You got 2 teeth, 1 tooth on one side, 1 tooth on the other side, and in the middle you have a missing tooth, and so you have this fixed bridge that's cemented to the 2 teeth in order to replace the additional one. So that's called a 3-unit fixed bridge. One of those teeth, the back tooth, usually will be just adjacent to the sinus, and sometimes a tooth like that will go bad. Now, what do I mean go bad? It means that the nerve within the tooth, which doesn't just have nerve tissue but has blood vessels, though that entire area dies. And so instead of having blood vessels, you have bacteria and rotted material within that tooth. That rotted material will then start in the middle of the tooth and go through a hollow tube in the tooth up towards the sinus and make a hole in the sinus. Now, it'll make a hole gradually. It'll get bigger and bigger and bigger. And you'll say, well, it doesn't bother me. Well, I get a toothache every once in a while, but then it goes away, and then it comes back. And I'm able to tolerate it for a couple of days, maybe take a little bit of Tylenol or something like that, and then it goes away again. Essentially, what that means is this. The bacteria is building up. It's building up pressure in the area of the sinus and is separating and actually eating a hole through the bone that separates the tooth from the sinus. It will place pressure. It'll create a hole, and when it creates the hole, then that pressure drops, and now the tooth feels better. And so then it builds up more pressure again, and now you have the toothache, and then it drains through the sinus some more, and the more that happens, the more bone that is dissolved between the tooth and the sinus. It's kind of difficult to picture it on radio. I'm trying to give you a radio description of a physical event. But the fact is that tooth, because it's cemented to the tooth in front of it, you don't feel that tooth is loose. If that tooth were sitting by itself, it would be loose and come out. But because it's attached to the bridge, the tooth feels okay. It feels tight. sometimes the patient will say, and even, well, I hope the dentist doesn't say it, but I suppose that would occur too, let's just let it go for a while. But when you take a CT scan, you'll see the hole that's being drilled, that's being formed in the sinus. And so if you're taking a diseased tooth and you're trying to keep the bridge going for as long as possible, you do that at the peril of your health, because now you're blowing a hole from your mouth into your sinus. So eventually that area is going to become so infected that you have to take it out. And when we take that tooth out, we take the tooth out, we look through the socket, and when we look through the socket, we see a hole that goes all the way up into the sinus. We can't leave it that way because that hole will stay, and every time you drink something, for example, it'll go in through that hole, and now it'll go through your nose. You can't have that. You can't have an area that's supposed to remain sterile and have it being contaminated by mouth contaminants. And so when we take out that tooth, we have to do a grafting procedure of some kind. We have to take soft tissue and elevate a big flap. We call it a flap. We elevate that gum tissue up under the cheek so that flap will be loose, and now we can cover over the hole in the sinus. That can be a fairly painful surgery, and you have quite a bit of swelling afterwards. Sometimes we have to rotate a flap from the roof of the mouth to cover that area. There are other ways that
do you do that kind of stuff very often?
I do that. We do that, yes, yeah. No, do we do it very often? When I was doing surgery, I would encounter it about twice a year. And twice a year doesn't seem like a lot, but it is a lot. You know, let's assume I see 500 new patients a year, 600 new patients a year, something like that. 2 of them have this over-retained tooth. And it's a surprise to them when I tell them, listen, not only does the tooth have to come out, but you've got a hole in your sinus. Take a look at it, and you can see it in the CT scan. It's easy to see.
What's the danger I have like a double-barrel question.
Yeah.
What is the danger of the hole in the sinus? And then on the other thing, besides what you were talking about, is there something else that can cause a hole in the sinus?
Well, there are lots of things that can cause holes in the sinus. I'm just talking about the dental thing. The biggest problem is that if you have a hole in the sinus, then anything that goes in your mouth can go up into your sinus. That's not good for your sinus.
Because it goes up into your nose.
Yeah, that's not very comfortable, number one. Number two, once it gets up there, how do you get it out?
How do you?
Well, the key is you don't leave it open. Because if you do need to get it out, there are a number of different ways of doing it. You'd go to an ear, nose, and throat specialist, and they use some kind of a water pick device to try to rinse it out. But the fact is that hole remains. You can't allow that hole to remain. Now, eventually, some soft tissue will close over that hole, but usually there's just a small hole that remains, and so every once in a while you have a hot liquid or something like that, it'll go up into the sinus. It's not healthy for you. And so we close it. I mean, whether you're seeing a periodontist or you're seeing an oral surgeon, who are the two people who would address that problem, if we see a hole in the sinus, we're going to make sure it's closed. Now, there are minor surgical ways of doing it or more major surgical ways of doing it, which is what I described, depending upon the situation. You obviously go for minor before you go for major.
It'll be safer for the individual.
Oh, and a lot more comfortable for the individual, too. Yeah. There are ways in which we can plug up that hole with, we've talked about the fact that you can draw blood out of the arm, you can spin that blood down in a centrifuge and recover a membrane out of that. You can put that membrane up in the socket, and that may be enough to allow the body to form its own covering for that sinus, so it'll be okay. That's the simple way of doing it, and that's what we would attempt first. If that doesn't work, then we have to go to more aggressive means.
How long, if you do something like that, how long would it take a procedure like that to take effect?
Well,
speaking,
assuming that it succeeds, and they do almost all the time, but assuming that it succeeds, you're essentially getting a mechanical lock between the tissue on the cheek side and the tissue on the palatal side, and you've got to suture that closed. So once that you suture that area closed, then the first warning we'll give a patient is don't blow your nose for 2 weeks, because if you put too much pressure, if there's too much nasal pressure, it'll blow open those sutures. Yeah. So it's only gentle dabbing of the nose. It's no heavy nose blowing. By that time, that gives enough time for a clot to form. And when the clot forms, then that will organize into normal tissue, and that will create the sinus closure.
You know, when I started the show off, I talked about the need for information and education. I I don't know of any kind of a venue that people that listen to a radio show or people that live a daily life would ever be exposed to what you and I are talking about right now.
Yeah.
But it to me, it signals more than the fact that there could be a hole in the sinus and pain. It tells me that more of us need to be better informed about cause and effect relationship of almost everything on what happens in our body. We can't ignore one thing because if something happens in our leg, we think it couldn't be related to our heart or it couldn't be related to our brain or something, but it could be. There are things, just because it's located in a different part of the body doesn't mean there's not a cause-effect relationship someplace else in the body.
Of course. We see that all the time.
And for a number of years there one of the biggest danger signals people were coming through on the dental profession was that if you had infections of different types and you were a heart patient, that if you didn't take proper care of your teeth, you were endangering your heart condition.
Yeah, and you've got to make sure periodontal disease is under control. And we've talked about this a number of times.
Yeah.
One of the big bugaboos that I have is that periodontal disease sometimes isn't treated correctly, and the patient isn't referred to a periodontist soon enough, and that's a big problem we have in dentistry right now. And of course, I've circumvented that by making sure that people see the periodontist first, because that's how I market to the public. But you've got to make sure that not only do you diagnose a periodontal pocket, which is the loss of bone support between the gum and the tooth, but you also have to identify what's in that pocket, because there are certain bacteria that are more aggressive than others, or certain bacteria that will be more related to heart disease than others. So it's not unusual for our patients with periodontitis for me to have them spit in a cup and send that saliva out to a laboratory so we can identify the DNA components of the bacteria that's there. Because if that bacteria happens to be a bug called Treponema denticola or Porphyromonas gingivalis, which are big words that say danger, 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 danger to your heart, then we can have a tendency to say, oh, the pocket is okay, it's not getting any worse if all you're doing is measuring it. But if you can't identify what the contaminants are within that pocket, in fact, you're allowing a bad bacteria to continue under the gum. Well, what's the big deal? It's under the gum. The reason it's a big deal is because that bacteria is right adjacent to the blood supply to that gum tissue. And so that bacteria then gets absorbed into the gum tissue. And that bacteria can travel. And not only that, but then there's an immune response that occurs. And when the immune response occurs, then there's certain white blood cells that come that also increase inflammation in that area to try to heal it. But that inflammation circulates and can get into the heart, into the kidney, into the lungs, into the brain, and can cause inflammatory problems that wouldn't be there if you had solved the gum tissue or the bone or the periodontal problem to begin with.
So just like we recommend, every time I've had an eye doctor or an optometrist on the radio or TV show, one of the last things they always say is have a regular scheduled checkup for your eyes. Get in to see an optometrist so that they can take a good look at your eyes and see what. Same thing for a dentist.
It's true because if I go to Mike Mandisi. If I go to Mike, and Mike will find other things that are related to my health by looking at my retina. It's very interesting. So there's a lot of reasons for the eye examination besides just refraction, deciding what the strength of your glasses, your contact lenses should be.
Yeah. Tooth pain, sinus pain, a lot of these things are things that we cope with on a daily basis. And one of the things I've been trying to relate to is having our commissioners understand the overall health of senior people, older people. A lot of our nonprofits in Brevard County do things that help mitigate for better health. They provide for more stable food supplies. They provide for better nutrition. They provide for certain types of medical care. They provide, like us, for information and education so people know where to go to get the right kind of help. But if, under the guise of thinking we can improve roads or do things that we probably could do a different way, and keep trying doing all this stuff and say, yeah, but our budget's $1 billion. I just wrote an article for Hometown News. It'll be out tomorrow, and I hope more of our listeners will read this article, because in the end of the article, I point to the fact that it might just be time to think about increasing our tax base. You know, the cost of living has gone up. We like to think we can keep our tax base low, but sometimes you just have to. You might. It just costs a little bit more to live than we think, and we have to be willing to share some of that burden. We have a lot of people that could afford to afford the cost of a little increase in tax. It's not going to hurt anybody. A very, very minuscule.
Oh, I don't agree with you at all.
I know.
I don't. I mean, if you take a look,
why don't you?
If you take a look at what's going on in Palm Bay right now with that Warriors Home for Warriors project.
Oh, I agree.
That's what happens when government takes over something like that. I mean, listen. I'm not conservative in every single area, but I'm certainly conservative there. I don't think there's any government official or any group of government officials who can guard me better than I can guard myself.
That's not what I said.
And but you are saying that because now we're looking at funding. Okay, if we have it funded, you know right now that money is going to organizations that are serving seniors that aren't doing a darn thing, correct?
Yeah.
All right. So if we increase our tax base and those particular organizations get more money, tell me, what's going to happen for seniors? Is that going to make things better or worse?
Well, I got two ways to answer that. Let me just point out.
By the way, we're talking about teeth still.
No, we don't have a lot of time, but if you let me tell, we'll get the answer.
All right, good.
You just made a comment about taxes, and when you read the article, also in this article, I point out the fact that since we have an extremely good Veterans Affairs office out in Vieira at the county office, manned by 5 or 6 people that can do a fantastic job of helping everybody in the county, why was it even necessary for the city of Palm Bay to have a separate Veterans office in the first place?
Oh, I think once you see the investigations, you'll find out why. It will have nothing to do with veterans.
Right, and that's the problem. But my point was, Lee, that you can't meet increasing needs that you can't control people getting older. People are going to get older, and we have better medicine. We have different things that are causing people to get older. And all I am saying when I talk about increasing taxes, our governing forces have to be attuned to the fact that we just can't keep increasing the county pay, the county retirement benefits, the county medicine system, and expect somebody to pay $20 in medical costs per month when somebody else is going to pay $1,000 in medical costs. That's not right.
I agree with that. So, but how do you vet the particular agencies? Because some of these agencies get money every year by habit. It has nothing to do. They don't qualify for it. They say, we do something. Nobody's looking at their books to see whether they're really doing it or not. If you could tell me that there was a way of making sure that, I talk about a lot about ethics. I talk about it in dentistry. We'll talk about it here, too, that somebody is actually doing what they're supposed to do. And, in fact, the money is going where it's supposed to go, and it is done efficiently, I'd be all for it. But we don't see that in government. I mean, we may see it in some areas, like the Veterans Affairs Office. We may see that. But at the same time, things like Palm Bay happen.
Exactly right. And until we get a better system where we hold more people accountable, it's going to continue to happen that way. If you don't hold people accountable, you have no way of knowing if it's going for the right reason or for the wrong reason.
Well, to me, then I would want to see the accountability project first before I would ever say, yeah, increase taxes.
For 15 years, I've argued with Florida Today about the need to post on a monthly basis what the county budget is and what the school budget is, what we're given, what each target budget is, maybe in 20 areas, and show a monthly progression towards meeting that. And if the school board and if the county commissioners were held accountable to the citizens of Broward County to see where the money's being spent, we'd all have a better idea of understanding what it is we need to. And if somebody said we can't, we just simply don't have the money to do that. If you citizens want this done, then we do have to maybe increase our taxes a little bit. What they have, I made a phone call the other day. We just put a penny tax in or half a penny tax in on the schools to generate an initial $35 million. I asked where that money is being spent. They couldn't tell me, or wouldn't tell me.
Yeah.
I don't know if it's a C or a W, couldn't or wouldn't, but I couldn't find out. My problem is, Lee, that we all need to know more about taking care of our bodies. We need to know about the systems that govern our ability to take care of our body, meaning our taxes, our money, our programs, what our nonprofits do. There are good ones and bad ones. You're right. We need to sort out the ones that aren't doing their job. And that's where I believe that we should hold the county government responsible for doing a better job instead of just sitting in their offices. They should go out and inspect these organizations. It should be the Housing and Human Services Department's responsibility to know what's happening.
It may be. I think if you found me an ethics program that really verified everything they're supposed to verify, because if you take a look at county government, if you take a look at city government, you take a look at federal government, state government, you're finding all of these things that are going on, that programs are funded, and then, okay, the funds are distributed, but then those funds aren't spent wisely. It's a systematic problem. And I'm not saying, by the way, in private business that we're doing much better. Maybe we are doing better because there's a certain profit incentive in order to be able to make things work, and so you got to satisfy the customer, if you will, in order to be able to make things work. Whereas in government, you kind of don't.
I think what you pointed out in Palm Bay is just like Palm Bay. Rest of the world, kind of everything really needs to be checked periodically by outside sources. If you do it in house, you're not going to really find out some of the things you need to know.
Yeah, let's have more discussions about teeth sometimes.
We can do that. We can do a show on it sometime. But I do want to thank you today, Lee, because tooth pain is not a pleasant thing. For our listeners who've had it, I know that it hurts.
It does.
But thank you for being here, and thank you, listeners, for listening. And we'll see you next week. Have a great weekend, a safe weekend. Take care. Bye-bye.